Okay, ladies, thanks for joining me. We are going to imagine that this is a hospital setting, very sterile environment, and Patricia, the trainee, is going to feel very comfortable, and Mary and Jane, it'll be up to you to maintain that comfort level with her. Alice and Carol, you're just the opposite. You're not too happy about what's going on. You don't like what's on the screen. You're not happy about what's being said. Constructive feedback, of course, but there will be two differences between what you have to say. Let's see if she picks up on it, okay? There'll, of course, be timeouts if she feels uncomfortable, and we can rewind, and we'll, of course, have constructive feedback. Okay, Patricia, this group is here to hear what you have to say about the study. The stage is all yours.
Okay. Hi, my name is Patricia, and I'm from the Triabetes study, and I'm here today to explain the study a little bit to all of you, to explain the type of people that we're looking for and some of the things that the study would involve. Basically, the Triabetes study is looking at 3 different treatments for obesity. One involves lifestyle intervention, which is basically diet and exercise, and the other 2 options that we're looking at are 2 different types of bariatric surgery, which is weight loss surgery. One of the things that's been found is that people who are severely obese and have type 2 diabetes, when they have bariatric surgery, the type 2 diabetes sometimes completely goes away, completely disappears. And it's not really clear whether that's because of the amount of weight that they've lost or something related to the surgical procedure itself. And also another question, and one that we're especially interested in on this study, is whether people who are less than severely obese, say maybe 65 to 95 pounds overweight, a little more moderately obese, what's the best treatment for them? Obesity, of course, has become a very large health problem in the United States today. 65% of adult Americans are considered overweight, and 31% are considered obese, which means that their BMI is greater than 30. We'll talk a little bit more about BMI later in case that's confusing. Also, 24% of these people have metabolic syndrome. So what is obesity? Usually in a clinical setting, we use the term BMI to define that. And BMI stands for body mass index. And basically, it's a measurement of an individual's weight in relation to their height. We can help you out afterwards when we do the screenings after this meeting and help you calculate your BMI to find out what it is. But they're on the internet. There's BMI calculators widely available that anyone can use. So it's pretty easy to figure that out these days. A BMI of 18.5 to 24.9 is considered to be a normal weight. When you get to the range of 25 to 29.9, that's where you fall into the range of being overweight. And when you get above 30, you've reached the point where you would be defined as being obese. For the Triabetes study, basically we would start out with a screening process, which we can do today, to see if you meet our basic criteria. And if you do, then you would be assigned to come in for the next 4 visits of the study. Everyone would then be assigned randomly to one of the 3 treatment groups, either diet and exercise or one of the 2 bariatric surgeries. Okay, so at this point, I will open up the floor to any questions in case anything I said wasn't clear or anyone wants some more explanation or elaboration on things.
I have a question. I was wondering, how long do we have to decide? I mean, how long do we have to think about it before you decide to stop taking new people?
We are going to keep recruiting until we reach a total of 60 subjects. We're hoping to do that within the next 9 months, but it's possible that we would reach our goal of 60 people before that. So you could wait a little bit, but I would not recommend that you waiting too long because we might find enough people and then not have room for you if you're interested.
Well, if I did decide to do this, once I made that decision, how soon would the process start?
After you had passed the initial screening, there would be 4 visits, a medical visit, a psychologist visit, a dietitian visit, and a research visit where we would gather all the measurements. And probably to get all those visits in would take about a month, so probably about a month, and we would assign you to one of the groups and get you started.
So I guess we wouldn't be paid for any of this?
That is correct. There's no financial compensation for the study. However, anything that you received as part of the study would be completely at no cost to you, which means if you were assigned to the diet and exercise group, all of the visits for that we provided would be completely free of charge. And if you were assigned to one of the surgical groups, your surgery and all of the visits before and after that surgery related to it would be also completely at no charge to you.
Time out. Patricia, how did that go for you?
I think things went pretty well. There were definitely people sitting in the front row that had lots of questions. They were good questions, and they sound genuinely interested in the study. But I guess, now that I think about it, I guess the people in the back of the room really maybe weren't as interested. They didn't have any questions.
Okay, Mary, how'd that go? What kinds of things did you like about Patricia's presentation?
Well, I think she...
Remember always to address her.
Oh, okay, yeah. I think you were interested in my questions and really wanted to answer them and wanted me to ask the questions. And then when you answered them, the answers were clear and answered my questions well.
Alice, Carol, anything she did that you liked?
Well, I thought her tone of voice was very clear. However, she focused on the front row. It appeared that she totally ignored my discomfort in this location. In addition, I felt the use of obesity so often was offensive to me.
What about you, Carol?
I thought it was a very smooth presentation. I thought that you did that quite well. I also was a bit affronted with the use of the word obesity. And also I think that perhaps if there was a different location, perhaps one that we felt more comfortable in, we might be more open to your presentation.
Based on this feedback, the class decides to find a more comfortable setting for the African American women. The proprietor of a local beauty salon invites Patricia to role-play her presentation in her establishment. The proprietor wants to help her clients learn more about improving their health, and she offers to introduce Patricia to Carol and Alice in her salon, hoping that, in this new setting, the women will feel more comfortable and be more willing to engage with Patricia about the study.
Okay, class, here we are at a different location, a new setting, and it should be different for you, Patricia. We had a little communication problem the first time around. Let's see if we can rectify that this time. Remember, you can always call a timeout if you feel uneasy or get in trouble, and we can rewind. You can go back to that certain point and start over again. I'm going to start out by having Glenda, the shop owner, introduce you to Carol and Alice.
Okay.
Glenda?
Hi, Alice and Carol. Hey. How you doing? I have Patricia here today, and she's going to offer us some information on the complications that go along with diabetes.
Okay. Thank you very much for inviting me to be here, Glenda. It's a great opportunity. Carol? Hi. Nice to meet you. Alice, hi. Nice to meet you. So I'm here today to talk about the research study that I work on, which is called the Triabetes Study. And basically, we're trying to find people who have type 2 diabetes and who are also overweight, about 30 to 60 pounds. And what we're looking at in this study is how the weight loss surgery could possibly improve the diabetes. Because what's been found out is that with type 2 diabetes, as you probably know, weight loss exercise usually helps it, but doesn't make it go completely away. But it's been found that in people who are very overweight, 60 pounds or more, when they have weight loss surgery, that improves the diabetes. Actually makes it go away. The symptoms of it actually completely go away.
Just like completely gone?
Mm-hmm. Yeah, okay. The symptoms would go away. They wouldn't need any medication or treatment. What we don't know is if that's because of something related to having the surgery or just the amount of weight lost. And also, something that we're specifically trying to look at too with our study is whether people who are less overweight, maybe 30 to 60 pounds overweight, what would best help them and their diabetes? Would that be weight loss and exercise, or maybe the weight loss surgery?
Do you have to lose a lot of weight? Like, I wouldn't want to be a twig. Like, I like having some curves.
Well, that would be up to the surgeon that you would meet and talk to if you were put into the part of the study that would receive the treatment of surgery. But obviously, we would aim to get you at a healthy weight.
So What exactly would be a healthy weight? Because I mean, I don't really think that I'm really that overweight.
Do you have diabetes?
I don't know.
Does diabetes run in your family?
Actually, it does. Yeah, my mom and actually my grandma both had diabetes.
Okay, that also can put you at risk to develop diabetes as well.
Well, does it matter about how old a person is?
Actually, we're looking for people who are, I have some brochures here, and it outlines that as well. We're looking for people who are 25 to 55 years of age, people who are approximately 65 to 95 pounds overweight with type 2 diabetes, and who are willing to be a part of a study where they would be placed in a random group, a random treatment group. Would you like a brochure to look at?
Yeah, there's information. Give it to your mom. Maybe she can
Take it from
pass
your
that
mom.
information on. Yeah.
Oh, sure. Yeah, if you know anyone who'd be interested, you can
I'm
pass
pretty
that
sure there's
information.
someone else that you can let inform on that information. It's very important information.
Might be
We need
good
to
for
get
her.
out to the community.
You think so?
Yes.
Yeah, read it.
Okay, time out. Patricia, how did that feel? How did it go for you?
Carol seems to be interested in the study and was willing to take a brochure, and she definitely asked some questions, so she's definitely showing some interest. Alice seems to be more reluctant. She didn't want to take the brochure and doesn't really seem to consider herself as a candidate for the study.
Okay, anybody else? Anybody else in terms of what she did well?
Well, I really liked that she explained about diabetes and some of the problems that it causes, and some of the risk factors as well.
It might be a good idea to try a one-on-one exchange between Carol and Patricia. See if that'll work. Let's
I'd
try.
love that. Yeah.
Sure, we could try that. Okay, so Carol, have you had a chance to look over the brochure?
I looked at it briefly. I didn't get to read the whole thing yet.
Okay, were there any questions that you had off the top of your head?
Well, I was just kind of wondering more about the surgery. Could you tell me a little bit more about it?
Sure. The people that would end up being assigned to a surgery treatment group, they could potentially receive one of two different surgeries. The one surgery, you may have heard of these in the news. One surgery is called the Roux-en-Y bypass, which is where the surgeon goes in and makes the stomach smaller and reconnects the small intestine in a way to make the stomach smaller. And the other one is a laparoscopic band surgery, where a band is actually placed around the top of the stomach, and that can be tightened and adjusted to make the stomach smaller.
What are some side effects of having your stomach be smaller?
Obviously, if your stomach is smaller, you're going to be eating less. That's the hope, is that you would eat less, and that would also result in some weight loss. And that also with your stomach being smaller, you wouldn't feel as hungry all the time, so that it would be easy to eat less and lose weight.
Okay, time out. Not that you were doing anything wrong, it's just for time purposes.
Okay.
Okay, did anybody notice anything they liked about Patricia's presentation this time around?
I noticed that Patricia had good eye contact, and she was really engaged in the conversation and answered the questions as presented by Carol with good information.
Are you automatically going to be included in the study for surgery if you sign up?
I thought so.
Let's see if we can rewind, go back to that specific point and address that issue.
All right.
Okay, let's rewind.
Okay. So Carol, you have the brochure there. Have you had a chance to look it over?
I looked at a little bit of it. I'm gonna read the rest when I get home.
Okay. Did you have any questions that you have off the top of your head right now?
Well, I was wondering about the surgery. I was hoping you could tell me more about that.
The study actually, if you sign up for the study, if you're eligible and you meet our criteria and agree to do the study, there's actually one of three outcomes that you could be assigned to. Not everyone's going to get surgery in our study. You would potentially be assigned to one of three tracks. One track would get just a weight loss and exercise program and help with changing their lifestyle to help them lose weight, and they would not get any surgery. and the other 2 tracks would get a type of surgery, and each of those 2 others would be a different type of surgery. So basically, like I said, if you enter our study, you would be randomly assigned, because